Dr. Menares, did Secretary Kennedy ever give you instructions on how you should interact with members of Congress?
He did. After the morning meeting, I became very concerned. I was alarmed that I was not being consistent. I would not be consistent with those areas that I had committed to this committee that I would do: transparency, integrity. And I had reached out to the committee to share my concerns. Secretary Kennedy became aware of that, and he was very concerned that I had spoken to members of Congress, and he told me I was never to do it again.
Congress and the American people need to know what is happening at the CDC, and this censorship is not radical transparency, and it is unacceptable.
In a hearing that feels more like a showdown than a Senate session, the name Robert F. Kennedy Jr. echoes through the chamber, not as an activist or a candidate, but as the Undersecretary of Health accused of silencing science and undermining America's public health system. Today, senators are demanding answers. How did the man who once promised radical transparency end up accused of censorship, manipulation, and a dangerous disregard for scientific integrity? Why are senior CDC officials claiming they were blocked from advising him? And what does that mean for the future of vaccines, pandemics, and the safety of American families? This isn't just a policy debate. It's a clash between ideology and science, between leadership and accountability. Welcome back to Behind the Podium, where we break down the most powerful moments in Washington and expose the truth behind the words that shape our nation.
Dr. Menares and Dr. Howry, thank you for being here today and being willing to provide this committee with information about what is happening at the Centers for Disease Control and Prevention under Secretary Robert F. Kennedy Jr.'s leadership. Despite his proclamations of radical transparency, Secretary Kennedy has consistently failed to provide information to Congress as he continues to undermine public health from his role in the Trump administration. You've heard from me before, having Secretary Kennedy in charge of the health of Americans is dangerous. And what we're hearing from you today really underscores this for me. Dr. Menares, when your confirmation was before the Senate, I had my doubts that anyone in your position would be able to stick to the science and stand up to Secretary Kennedy as he compromises the health of the country in order to further his own ideas and agenda. I am pleased to see that you and other senior members of the CDC, like Dr. Howry, did stand up to him when the time came. You've both spoken about censorship and requests to compromise scientific integrity. Dr. Menares, did Secretary Kennedy ever give you instructions on how you should interact with members of Congress?
He did. After the morning meeting, I became very concerned. I was alarmed that I was not being consistent. I would not be consistent with those areas that I had committed to this committee that I would do: transparency, integrity. And I had reached out to the committee to share my concerns. Secretary Kennedy became aware of that, and he was very concerned that I had spoken to members of Congress, and he told me I was never to do it again.
Congress and the American people need to know what is happening at the CDC, and this censorship is not radical transparency, and it is unacceptable. Dr. Howry, I was shocked to learn that you found out about the changes to the COVID vaccine policy on the social media platform X. Decisions like this must be made in consultation with CDC experts, because otherwise we are left wondering who is advising the Secretary of Health, or if his own conspiracy theories are enough to dictate who can get a vaccine. Dr. Howry, did you ever brief Secretary Kennedy?
I never briefed him. I accompanied him on a tour of CDC after the shooting.
Did your center directors ever directly brief Secretary Kennedy?
They did not.
You were the chief medical officer at the CDC. Would you say that it's harmful to the public if the secretary is not informed by experts like yourself?
Very much so.
How would you characterize Secretary Kennedy's approach to working with scientific experts at the CDC?
You know, we would have loved to have had the conversations with him. I offered to 2 different HHS leaders that we would like to brief the secretary. He never received that, and many times I would send emails to our leadership team to share with HHS when he did say things that weren't scientifically correct so that we could help support him. But again, our requests were not received to brief him.
So tomorrow, ACIP is set to discuss childhood vaccines. And based on what we've seen happening under Secretary Kennedy's leadership, we have to expect it will produce weaker recommendations for these vaccines. And at the same time, there is no Senate-confirmed CDC director in place. Secretary Kennedy has installed someone he is convinced will rubber stamp whatever decisions his anti-vaccine advisory members make as the acting director. In Wisconsin, there are currently 36 cases of measles, all in unvaccinated individuals, 22 of whom are children. I am thankful that we have not seen any deaths yet, as we have in Texas. Dr. Oury, you have seen firsthand in the ER what vaccine-preventable disease can do. What would an increase in vaccine-preventable diseases mean for children and families across the country?
It's going to be heartbreaking. Not only will it overwhelm our healthcare system, but children will have, some of them will be deaf. You know, we've seen congenital measles cases in the U.S., and I think what concerns me is these aren't harmless diseases. We just saw the case in California of a young child that died of encephalitis from years after measles. These diseases have long-term consequences, and we don't need, in the U.S., we have gone so far in reversing this. We don't want our children to die.
In a hearing that felt more like a political battlefield than a Senate session, the name Robert F. Kennedy Jr. echoed through the chamber, not as an activist or an environmental crusader, but as the man now responsible for safeguarding the health of the American people. Under his role as Undersecretary of Health, Kennedy has promised what he called radical transparency. Yet, as Senator Tammy Baldwin and other lawmakers made clear, his actions appeared to be anything but transparent. What unfolded inside that hearing room wasn't just a policy discussion. It was a confrontation between science and ideology, truth and authority, trust and fear. Senator Baldwin's opening words cut through the room like a blade. She accused Secretary Kennedy of undermining the very agency tasked with protecting public health, the Centers for Disease Control and Prevention. According to her, Kennedy's leadership has been marked by secrecy, suppression, and a troubling pattern of silencing scientific voices. His so-called transparency, she argued, had turned into censorship. And as the hearing went on, it became clear just how deep that problem ran. 2 key witnesses sat before the committee, Dr. Menares and Dr. Deborah Oury, both senior officials from the CDC. Their testimonies painted a picture that should alarm anyone who believes in science-based governance. Dr. Menares recalled a meeting that shook his confidence in Kennedy's leadership. He described how, after raising concerns about integrity and transparency, he reached out to members of Congress, only to be reprimanded by Secretary Kennedy himself. According to Menares, Kennedy told him directly that he was never to speak to Congress again. That single statement revealed something chilling. A health leader more interested in control than communication, more invested in loyalty than truth. Then came Dr. Oury's testimony, quiet, measured, but devastating. She revealed that she had found out about major CDC policy changes not through internal briefings or expert consultations, but through social media, on X, formerly Twitter. Imagine that. The chief medical officer of the CDC learning about new COVID-19 guidelines the same way the public does, by scrolling through her phone. Senator Baldwin, visibly stunned, pressed further. Did Secretary Kennedy ever seek briefings from CDC scientific leaders? Did he ever consult the experts before making health decisions that affected millions of Americans? Dr. Oury's response was simple. He never received that. She said she offered multiple times to brief him. She sent emails correcting scientific misinformation he'd shared publicly. But time after time, her efforts were ignored. We wanted to support him, she said. We wanted to help with facts. But Kennedy wasn't interested. The CDC's top medical voices, sidelined and silenced, were left to watch as public health decisions unfolded in real time, without them. That was the moment when the hearing took a darker turn. Senator Baldwin shifted the conversation toward vaccines, an issue that has defined Robert F. Kennedy Jr.'s public image for decades. She pointed out that the CDC's Advisory Committee on Immunization Practices, or ACIP, was scheduled to meet the next day to discuss childhood vaccination recommendations. But under Kennedy's leadership, Baldwin warned, Americans could expect weaker standards and potentially a dangerous rollback of protections that had taken generations to build. Her warning wasn't theoretical. She cited her own state of Wisconsin, where 36 cases of measles had recently been confirmed, all among the unvaccinated, 22 of them children. So far, no deaths, but in Texas, there had been. The implication was clear. The consequences of anti-science leadership aren't measured in press releases or political points. They're measured in infections, in hospital beds, and in lives. Dr. Oury spoke again, this time as a physician, not just a policymaker. Her words carried the quiet weight of someone who has seen what preventable diseases can do to real people. It will be heartbreaking, she said. These are not harmless diseases. She talked about children left deaf, babies born with congenital measles, and the tragic case of a young child in California who died from a disease the U.S. thought it had eradicated. She described not statistics, but faces, and her message was simple. If science is ignored, suffering will follow. At the heart of this hearing lies a question far greater than politics. Who is actually guiding America's public health? If not the CDC scientists, then who? If not the doctors and epidemiologists who've dedicated their lives to understanding disease, then whose judgment shapes national policy? Senator Baldwin didn't name names, but her meaning was unmistakable. She suggested that Kennedy was relying on no one but himself, guided by conspiracy theories and long-standing mistrust of vaccines and pharmaceutical companies. The irony was impossible to miss. The man who spent years telling Americans not to trust the CDC now commands it. And that, perhaps, is the most dangerous paradox of all. Because when skepticism becomes policy and ideology overrides evidence, the consequences aren't confined to Washington. They ripple outward to hospitals, schools, and families. They erode trust, they undo decades of progress, and they turn public health from a matter of science into a matter of belief. Dr. Monterez and Dr. Oury didn't come to the Senate to make political statements. They came as witnesses to a breakdown in communication, a crisis of integrity, and a warning that science itself is being silenced from within. Their testimonies revealed a government where decisions are being made not through consultation but command, where expertise is treated as opposition, and where the truth is filtered through ideology before it reaches the public. If their accounts are true, then what's happening at the CDC is more than a bureaucratic dispute. It's a national emergency. Because when science is politicized, it loses its power to protect. And when experts are ignored, the consequences come for everyone, red state, blue state, vaccinated or not. In the end, Senator Baldwin's closing words carried the weight of that reality. Transparency, she said, isn't about slogans. It's about truth. Leadership in health isn't about personal conviction, it's about responsibility. It's about listening to those who know the science, trusting the evidence, and standing by the people whose lives depend on it. And that's what this hearing was really about. Not just Robert F. Kennedy Jr., not just one administration, but the fragile balance between truth and power. Because when public health becomes a political battleground, it's not politicians who pay the price. It's children, it's families, it's the doctors fighting diseases we once thought were gone forever. As the cameras turned off and the senators left their seats, one truth lingered in the silence. The debate over vaccines, science, and trust is no longer a conversation outside government. It's happening inside the very institution meant to defend them. And the question that remains is whether the nation's leaders will have the courage to put science back at the podium before it's too late.